everyone. Thanks so much for joining us today. I'm Brianna Wagner. I'm the communications manager at Lawyer One. And today I have the privilege of speaking with Dr. Zachary Coburn. He is an MD in emergency medicine out in Albany, New York. Thank you so much for joining us today. How are you, doctor?
I'm doing great. It's a pleasure.
Oh, good to hear. So how did you get into medicine and how long have you been practicing for?
So I first got into medicine because I was actually an EMT at first. I became an EMT in high school and in college, and I just loved it. I really loved emergency medicine, but I wanted to do the next step, sort of become the expert and become, one of the more knowledgeable people in the field. So that's how I fell into medicine. The other aspect was I was actually a social science major in college. I studied medical anthropology, which I loved. I really enjoyed studying how people interacted with their health and understood their health. And in the end, I decided I wanted to be the one that would help directly deliver that health care, hopefully from a leadership position. So that's how I fell into medicine. And then I've been in emergency medicine for a few years now, and I'm really loving it. It's been an exciting time right now. But it's always exciting. Things are always changing. That's what I love about it.
Yes, and we thank you for your services, especially with what's happening in the current climate. So let's talk about this. It's funny because I actually went to the doctor's yesterday and I was waiting for the physician to come in. And I was looking around the room and I saw like this advertisement for this, like the first thing on their shelf, and it's Elmiron, and it is manufactured by Janssen Pharmaceuticals. What is it designed for and who would be prescribed to it?
So Elmiron is designed for people who suffer from interstitial cystitis. So maybe stepping back to understand what that disease actually is. It's more common than you think. In the United States, actually up to 10 to 12% of women suffer from it. It's more common in females than males, but it's thought to affect overall between 1 and 5 out of every 100,000 people. And what it is a chronic pain syndrome where it affects your bladder. So you have chronic pelvic pain. You may have some urinary symptoms like leakage and things like that. And it impacts your life because you're dealing with this chronic pain. And a lot of times it takes patients a long time to get diagnosed just because there's not a specific test for it. You don't, there's not like a specific lab test you can do for it. It's more of a clinical diagnosis. So the way Elmiron came around was that it was the first FDA-approved medical treatment for it. Typically, physicians will start with things like lifestyle management, things like avoiding certain foods or beverages that might make the symptoms worse. A lot of people, for example, find caffeine makes it worse because it makes you urinate more. And then if those don't work, then before Elmiron, the first-line medication was actually an antidepressant called amitriptyline. The idea being that a lot of people with chronic pain will also have some psychological symptoms as well, but amitriptyline is actually also fairly effective in treating pain as well. But that wasn't specifically FDA approved for this syndrome. So Elmiron came around in the mid to late 90s as the first FDA approved medication.
Wow, yeah. So you exhausted all other options. You start taking Elmiron. How quickly would you start seeing side effects, even if they're just subtle side effects?
So it depends. First of all, Elmiron takes a while to work. Potentially, it can take a few months to actually start kicking in and for you to start noticing a difference. The more common side effects are things like nausea and vomiting, and those can be fairly rapid. Some of the later side effects, sort of the big one that people are talking right now about, vision changes, doesn't typically come around until a few years later, typically like 3 to 5 years in.
Okay, gotcha. And okay, so 3 to 5 years, you would say, is when it would go from maybe typical side effects to something more dangerous or more concerning. And so if symptoms are pointing to vision impairment, what do you recommend they do at that point?
So the recommendations for Elmiron have changed. Initially, when it wasn't really clear that you could have visual side effects, patients didn't really follow with ophthalmologists closely while they were taking it. But now it's a few of the recommendations that are coming out is that once you start taking it, you at least see an ophthalmologist before you start taking it and follow fairly regularly. But once you start to notice side effects, and those side effects would be things like blurry vision, difficulty seeing colors, I would recommend that you see an ophthalmologist as soon as you can. Because once you get those side effects, there may not be a whole lot of treatments you can do for it. You can stop the Elmiron, but it's possible that the disease process in your eyes will continue. But you want to recognize if you're having a disease process in the eyes as quickly as possible.
So if they were to come to the ER and they are taking Elmiron, what would you say, like, keywords in order to kind of relay that message to the medical professional would be, as far as just being very straightforward with what they're dealing with?
As far as to the patient or to an ophthalmologist? So
the patient, if the patient were to come in and have an emergency with that, what would be keywords that you would suggest they use? Well,
the biggest thing I would tell them is, number one, it's your eyes. That's one of the most critical ways you interact with your world. And you don't want to mess around with your eyes. Anything that can affect your vision, you should take as seriously as possible. I would tell them that it's really important that they see an ophthalmologist as soon as possible. I might recommend that, they can stop the Elmiron until they see an ophthalmologist. And, if you remember, Elmiron doesn't solve the underlying disease of interstitial cystitis. It treats the symptoms, but it doesn't reverse the actual disease. So if you stop the medication, you may get some of the pain back, but you're not going to necessarily have sort of long-term effects to your well-being that would be as important as your vision.
Right. And like you said, as far as when vision impairment does come into place, there's not really a reversal for that, correct? It's kind of...
So far, it seems like there isn't. And some of the research is showing that even if you stop the medication, unfortunately, there's a chance that loss of vision will continue to progress.
Okay, I see. And so it is a very popular drug. Like I said, I saw it the other day, and you had mentioned the antidepressant was the other alternative. Is there any competitors that you've been hearing or potentially coming through the FDA or anything of the sort?
Not quite yet, but the upcoming medications aren't always heavily advertised. Especially the medication development pipeline takes so long. One of the things that I think competitors might keep in mind is that with this medication, the initial studies that were done for its approval only went out to a year. So they didn't catch the side effects of possible vision changes because those don't happen until several years out. So I think when a competitor comes out with a new medication, they'll probably have on their minds that with the studies that they're doing in order to get FDA approval, they may want to look a few years out to try to catch some of these longer term side effects.
Okay. And so typically now when you go into a doctor and you are considering Elmiron, that is your kind of last resort for dealing with this pain, that's something your doctor now advises you to do. And that would be to go see an ophthalmologist prior to starting the medication and kind of consistently follow through. That's common knowledge now? That's something that would be advised?
It's coming out. This whole deal with Elmiron, is fairly recent, within the past few months. So there aren't yet concrete specialty body recommendations, but it seems to be that it's heading towards most physicians recommending seeing an ophthalmologist before to get a baseline sense of the eye function and then following up regularly. So that way, hopefully, if patients are beginning to develop some of these side effects, they can catch it on the eye exam early on, potentially before the patient starts to notice serious side effects.
And would you say there's an age range that's more prone to experiencing side effects, or it kind of varies, or gender?
It seems like it's varied. Most of the studies that are coming out are showing that the biggest associations are with the maculopathy that may be associated with Elmiron, or number one, associated with how long you've been taking the medication, and then number two, the dose. Females tend to take the medication more commonly anyways, so most of the studies show heavy female predominance in having the ocular side effects, but there's probably some selection bias there because there are more females taking the medication to begin with.
And when I had read what you had written, you had said, your doctor should only prescribe it if they see it's worth taking the risks. What would you count as worthy for taking the risk?
So again, with interstitial cystitis, it's a chronic pain syndrome, and everyone should understand it can really impact your life pretty severely. That being said, pain doesn't kill people. Pain doesn't destroy or impact your vision seriously. And so you need to weigh those risks and benefits of, is the pain from the condition bothering you enough where you're willing to take the possible risk of having visual side effects. And whenever you have that risk-benefit discussion, it's important to have a full understanding of the risks. And I don't think we have a full understanding of the risks yet, because we don't yet know how common the maculopathy is in Elmiron, because it's only just starting to come out that there may be an association. So I think it's difficult for urologists and other physicians to advise patients on what the real risk is. You know, they can say, hey, there's some risk, but I can't tell you how common it is. And that makes that discussion really, really difficult, I think.
Well, yeah, thank you so much for joining us. You know, if you or a loved one are taking Elmiron and experiencing any vision problems or any side effects, please consult with your physician immediately. Thank you so much for joining us today, Doctor.
You're welcome.